Great. So, Dr. Mills, thank you for joining me. I know you're busy, so I appreciate you taking the time to discuss this a little bit. Hopefully this will be of great benefit to students and engineers alike who are looking to sort of improve the medical field. So my first question is, we were discussing colonoscopies, right? We were fortunate enough to film a colonoscopy. And my first question is, what is a colonoscopy? What is it for?
Okay, so basically a colonoscopy is a diagnostic or sometimes screening test used to try to identify pathologies within the inner lining of the colon. So typically a patient, there's a high risk of colon cancer in the States, in the world, but in the States in particular, since that's relevant to us. And they can be, there's a, what's what I'm looking for here. There's a discernible lesion that shows up prior to development of cancer called a polyp. Mm-hmm. And we do colonoscopies to identify polyps and remove them, or to try to identify cancers and biopsy them or remove them. And we can also find evidence of some of the inflammatory processes. So basically a patient cleans their colon out with a bowel prep, which involves taking things to make you poop a whole bunch over the course of several hours. And then come in and have a video with the colonoscope itself inserted. The colonoscope is a camera unit that has a light, as well as a camera, as well as something to insufflate to fill the colon with air, as well as a channel for inserting tools or for suctioning out things. So if there's a little bit of stool or some liquid, you can suction it out. Mm-hmm. And that allows us to insert the camera and visualize the mucosa, which is the inner lining of the colon, to try to identify things that are abnormal, such as polyps or areas of inflammation or cancer or things like that.
Right. Okay. So you mentioned polyps and cancer and inflammation. What are some of the common reasons, in addition to those, that people come in? Is it regular? Is it for specific concerns?
Yeah. The most common reason people get colonoscopies is for concerns about cancer, whether they have bleeding or they are just want to get checked for cancer. In America, it is generally recommended that colon cancer screening, meaning looking for somebody who has no symptoms of anything to see if they have evidence of cancer, mm-hmm. Could start at age, I guess it depends a little bit on which ethnic group you come from, what gender you are, and things like that, and also which regulatory body you're listening to, but generally the age of 45 or 50, depending on the group. Okay. There are some things that might be 40, and then if you have a family history or something like a personal history of a polyp or something like that, it might be sooner. And you get a colonoscopy with no symptoms to see if there's any evidence of polyps. And then sometimes if you have somebody who's had a prior cancer, or they've had a polyp removed in the past, or they have a family history or something like that, they may get a colonoscopy sooner. So if you've had prior polyps, the type of polyps you have removed, and the size of them, the number you've had removed, things like that will determine when your next colonoscopy would be, to basically try to prevent you from ever developing a cancer.
Got it. And so in terms of the screening, what is the confidence level with a colonoscopy? Is there sometimes other things that you do to supplement the screening?
Yeah, the colonoscopy is considered the gold standard. It has the highest level. It's a little hard to know what the exact positive predictive value, confidence level, things like that are with a test that doesn't have a test better than it to prove that it's right or wrong. Okay. It's felt to be in the high 90% range typically. There are other tests that can be done, however. There's something called a fecal occult blood test, mm-hmm. The FIT test, which are similar things, are basically stool tests looking for evidence of blood within the stool, which can be a sign of someone that should have a colonoscopy to see if there's a problem or not. There's something called a sigmoidoscopy, which is like a colonoscopy, but only goes partway in. And most patients with that do not get sedation for that. And the bowel prep is a little bit easier, a little less extensive. So that can be a simpler thing to do in certain settings. There's a DNA test, which can be done, which within the stool, are there certain DNA sequences that are found in polyps or cancers that you can find expressed within the stool, meaning the cells that have shed out of the colon, out of the inner of the colon, those cells end up in the stool. And if you find specific sequences of DNA that may be a sign of someone that has polyps or cancer, those tests can also be done.
Interesting. Okay. So when you're doing the actual colonoscopy and in preparation for colonoscopy as well, what are some of the challenges that you typically face?
Yeah, so from a patient standpoint, probably the biggest challenge is the bowel preparation, which is the clean out. Typically involves drinking something that makes you have a lot of bowel movements, and also a lot of liquid so that you don't get dehydrated.
Mm-hmm.
That often comes as up to a gallon, depending on what exactly you're taking. So some people get cramps. A lot of people get nausea. Vomiting is not all that uncommon with it, and so just a lot of patient discomfort with doing the bowel preparation in terms of getting set for the colonoscopy itself. In terms of the colonoscopy, it's not really painful. I've actually had a couple of them. They don't hurt, but you usually get sedation for it. It is it takes time off of work. You have to have a ride home if you get sedation. So in terms of societal costs, it can be more expensive than just the scope itself, because you also are time off of work and there's time off your ride home. And so that can, that can kind of cut into that. And then people don't like to talk about colon cancer. People don't like to talk about pooping. People like to talk about their bottom. And so there's a lot of social, it's almost like a social stigma, although I think that's probably too strong of a term, but there's like a stigma against getting it. So there's not, despite the fact that colonoscopies should be done on everybody, there are definitely people that don't get them that show up. In fact, the operation I'm getting ready to do right now is on an 80-year-old who has an obstructing colon cancer that's never had a colonoscopy before.
Okay. Wow. So what do you think are some of the things we can do to advance the conversation about colonoscopy and colon cancers and things of that nature?
Like societally speaking?
No, I just mean like in medical education. Do you think that there may be new approaches we need to take to make it less taboo, I guess?
Well, I think that in medical education, I don't think that the doctors, nurses, students, people in the biomedical field in general, I don't think are necessarily afraid of or feel stigmatized by talking about this, because I think they have a little bit better understanding of it. I think the bigger thing would be education of the general public to understand colon cancer is a serious problem. It affects a lot of people, hundreds of thousands of people a year in the States, and that it is preventable with colonoscopies.
Right.
Then you get a problem with cost, and you have to have insurance and all that kind of stuff. There's a lot of other issues, but I think making sure that the people who don't go into fields that do colonoscopies are aware of how important they are, so that they can make sure that their patients that they're in the care or get provided care for are referred. And in terms of a biomedical engineer, trying to figure out a way to make it have a higher rate of polyp detection, something to make it simpler. There is somebody here working on AI, looking at a computer algorithm where the computer can identify abnormalities within the mucosa of the colon. It can actually put a box around it on the screen in real time and say, this has a high chance of being a polyp. And that just takes a lot of pictures and a lot of pathology reports being put into a computer so that the computer can recognize it in real time. That's happening today. It's just a matter.
That's amazing.
Yeah.
And so do you use that side by side with the colonoscopy?
I haven't used it. It isn't widely available. There is somebody at UC Irvine who's developing it, but until it's not something that is widely used. I have used it before, but it's not something I get to use regularly. But it is pretty.
Yeah, that's fascinating. Those are exactly the kinds of approaches that we're looking to push forward on. So I guess my last question for you is when it comes to colonoscopies, big picture, I know you mentioned it's the gold standard and that there's a lot of really cool work that's happening right now. My question for you is, where do you see, the field of colonoscopies going in the future?
Well, I would like to think that it's going to go away, and that we'll have something that's simpler to take, something that's simpler for people to do, that has It'll never go away, or it won't go away easily for 1 second. I'll come back to, but hopefully we'll have a test that's better to show with higher predictability who should get a colonoscopy.
Mhm.
A colonoscopy, if you only did the ones that you're going to find something to remove, would make a lot of sense.
Yeah.
Excuse me. I think what's likely to happen is either imaging will get better. There are virtual colonoscopies using CAT scans, which do have the problem of radiation, but potentially some sort of computer modeling that works with an MRI might be able to decrease the false positives and false negatives. Although MRIs are so slow that I don't think that's something that's really viable yet at this point.
Right. Interesting. That's fascinating.
Anything you can do that doesn't require a bowel prep would make screening of the colon a lot more well tolerated by patients.
You said without bowel prep?
Without bowel preparation, yeah. If you can do something without having to drink all the stuff ahead of time, I think people would be a lot more into it.
Right.
Or something they can poop in a container and mail it in. That'd be pretty cool. There's something called Cologuard that is the DNA test that is basically that.
Yeah.
But it's not super widely used. I don't know how much it costs. It's probably expensive still. But
yeah, no, that's actually a really interesting approach. So with that being said, I have no further questions. I'm going to go ahead and stop the recording here.